this issue of Mayo Clinic Proceedings, we report the update of a national study evaluating burnout, professional fulfillment, and satisfaction in U.S. physicians at the end of 2021. I'm Tate Shanafelt, Chief Wellness Officer, Associate Dean at the Stanford School of Medicine, and I'm here to provide a brief overview of our manuscript, Changes in Burnout and Satisfaction with Work-Life Integration in Physicians over the First 2 Years of the COVID-19 Pandemic. Although a number of studies have looked at the experience of stress, burnout, depression, and other forms of distress in physicians during the pandemic, many of those studies have occurred in geographic hotspots, been targeted in specific specialties, and don't provide a historical context for the data. And this is important because we know that occupational distress is a challenge that long predated the pandemic. We have been conducting national studies of physicians and the general U.S. workforce every 3 years since 2011, and had reported a most recent update at the end of 2020, about 7 to 8 months into the pandemic. That report had showed that the experience of physicians at that stage of the pandemic was quite nuanced, with variation in whether distress had increased or gotten better, dependent on specialty, personal COVID experiences, and then also likely geography, depending on where you were in the United States. As the pandemic has worn on and just continued to exact a toll on healthcare workers broadly, we performed an off-cycle evaluation at the end of 2021 to evaluate things an additional year into the pandemic. And those results were really quite striking. They showed a mean score increase of about 38% in emotional exhaustion across the entire U.S. physician workforce, a 60% increase in the mean score for depersonalization, and illustrated that just over 60% of physicians had one or more symptoms of burnout. When we compared to the historical time points, not only were the changes over the 12 months between the end of 2020 and 2021 quite dramatic, the 2021 scores were the highest level on record going back over the last decade. What was also quite notable is how variable the results were by specialty. Although all specialties had increases in burnout over that interval, there were some that were hit particularly hard. When we looked at the 2021 data and did a detailed analysis of controlling for personal and professional factors, hours worked, and all other variables, emergency medicine, perhaps as expected, but also family medicine and general pediatrics were specialties at high risk, even adjusting for all other variables. One other element that was quite noteworthy was the disproportionate effect of the pandemic on women physicians. We know in multiple prior studies that women physicians have some higher risk of burnout relative to their men physician counterparts, even after adjusting for specialty and work hours and practice setting and other variables. Historically, that increased risk had been about a 25% increased risk once we adjusted for all other variables. In the most recent update, however, that risk was actually a doubling of risk, and so that increased risk that has been present for some time was profoundly larger on this most recent update, illustrating in some ways this differential impact of the pandemic on physicians by gender. The last thing that was also noteworthy is that there were not dramatic changes in the prevalence or severity of depression in the study, really emphasizing the point that the increase in distress over this 1 year interval in physicians was quite specific to work-related distress or occupational distress. So I think really provocative findings demonstrating the severity of the challenge, the extent of the suffering as the pandemic has worn on, and really depleted the physician workforce. And obviously, the need now is action, and both the National Academy has released its national plan to address the system variables at government levels, organization levels, and other structural levels in the system. Also, the U.S. Surgeon General has released his recommendations for changes needed at the level of the whole healthcare delivery system to address these challenges and help restore the clinical workforce. And hopefully we'll see meaningful action on those fronts to address this challenge.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.